Together we achieve victory over heart failure.
Hi everyone. I'll be telling few useful tips for the heart failure monitoring conditions, and then what are the useful numbers you have to know, and what are the vital signs you have to see. First of all, you have to know what is heart failure. Heart failure is a chronic and progressive condition where the heart cannot be able to pump enough blood for the body requirements. That is the definition of heart failure. Usually, it may be a systolic heart failure, or diastolic heart failure. That means it's maybe a pumping deficient or relaxation deficient. Either it may be there. Now, what are the symptoms patient will be having this heart failure? There is one criteria called Framingham's heart criteria. There is a major criteria, minor criteria. Depending upon the criteria, we can say patient is having heart failure or not. It's a simple thing only. If you see symptoms regarding heart failure, a patient will complains of dyspnea on exertion. Whenever he lies down, patient is having dyspnea. That is super heart apnea, they will say. And there will be hepatomegaly and there will be pleural effusion. If you auscultate the patient, we can able to see the rods. Sometimes you can able to see the LV S3 gallop will say. So these are all the useful signs we can able to elicit from the patient. Apart from the symptoms, what they will say, there will be swelling of the legs. They will say most important symptom patient will say is there is swelling of the legs, and they also complains of decreased urine output. So with all the symptoms, we can able to diagnose patient is having heart failure. Our next thing, what are the precipitation factors for heart failure is mainly we'll focus on the metabolic syndrome actually. Because that is the culprit for producing all the cardiovascular diseases, especially which are leading to heart failure. In that metabolic syndrome, the main thing is patient will be obese. If you see the waist circumference, it will be more than 1 or 2 centimeter in case of males or 8 centimeter in case of females. And next thing, if you check the blood sugar, there will be impaired glucose tolerance. That means the fasting blood sugars will be more than 110 millimeter of mercury. Then, and if you see the HDL level, it will be very low. It will be less than 40. And if you see the LDL, it will be more than 200 like that. So these are the things. And if you see the BP, it will be more than the regular monitoring BP. It is be more than 130 per 85 millimeter of mercury. So if the patient is having any three of the things, they will come under the criteria of metabolic syndrome. Why I am stressing is because this is the culprit which leads to the heart failure. Now coming on to the vital numbers, what are things we have to know is same thing what I told. We see the BP. The BP should be optimal BP. That means the patient has to maintain a BP, systolic BP of less than 135 and diastolic of less than 80. That is the most important thing they have to do. And if you see the blood sugar, ideally the fasting should be less than 100. If at all, it should not be more than 110. And if you check the HDL level and LDL level, depending upon the age criteria, there is guidelines differences there. If it is less than 19 years or younger patients, this LDL should be less than 110 millimeter of mercury. And if you see the HDL, it should be more than 45 milligram. And similarly, if it is more than 20 years in case of male, the LDL, it should be less than 100. And if you see HDL, it should be more than 40. Similarly, for 20 years females, if you see the LDL, it should be less than 100, but HDL should be more than 50 milligrams. So these are the most important numbers they have to know. And regarding the triglyceride level, it should be less than 150. These are the important numbers patient has to know regarding the monitoring of the heart failure. And lastly, if you see the heart rate, normally you all know the heart beats around 60 to 100 beats per minute. And in case of heart failure patient, naturally there will be sympathetic activity will be more. So they have to maintain an optimal heart rate with appropriate medicines. If at all a patient wants to exert some moderate activity, they should be have a rise of 50 to 85% moderate increase. That is the cutoff they can go. If it is beyond that, you have to give additional medicines to control the heart rate. So these are all the vital numbers you have to know so that you can able to prevent the symptoms of heart failure and you can able to prevent the progression of heart failure to stage 4 because there are various stages. Because in stage 4, patient will be moribund, they will be bedridden. Only option for them is heart transplant. So we have to prevent that condition. We have to monitor all the things throughout the thing. So these are useful tips. I think everybody will follow so that you can able to give advice to your patients and for yourself also. Thank you.